People with disabilities can face challenges accessing health care.
With going to the ER, if I don't tell them how to treat me, they would just treat me like any other patient who walks into the ER, and it would hurt me more than help.
The ambulance came and the paramedics told me that they could take me, but they couldn't take my dog, my service animal.
For medical appointments, sometimes it involves navigating the office a little differently than other people do. So in the dentist office, I have to wheel my wheelchair next to the seat and do a full tilt back.
Healthcare providers are required to offer everyone access to medical services without discrimination on the basis of disability. This means that although your needs may differ, the quality of your care should not.
I find that providers who also see OBGYNs, who also see patients in wheelchairs, won't even bring up the issue of a pap smear or a breast exam.
So going to any doctor's appointment or going anywhere in this world, it's not made for wheelchairs, or at least wasn't initially made for wheelchairs.
It's important to work with your provider and advocate for yourself to get the care you need.
One of the best ways for a doctor to really accommodate my needs is when they ask me questions and they don't make an assumption of what I can and can't do.
Being healthy and having a healthy relationship with provider goes both ways. So the provider has to be proactive in looking into my condition, but I also have to be doing the productivity where I need to look into, do the research for what provider I need and communicating my need to my provider, because they're not going to know unless I tell them.
Tell your provider we are going to need more time, likely an extra aid in the room because that's going to be needed for mobility and to move you.
You don't have to do this alone, but at the same time, you need to be the captain of the ship. You need to be very engaged in your care so that you can take care of yourself and your future, and ask for help when you need help, and to not be afraid to do that.
To learn more about how you can work with your provider to get the care you need and prepare for your next appointment, visit our website.